in today's Eye on Health segment, November is Pancreatic Cancer Awareness Month. Lately, many people are more aware of pancreatic cancer because of Alex Trebek. Game show host Alex Trebek has been very open about his diagnosis, and despite his high-profile case, pancreatic cancer is really relatively rare. Still, our next guests say you need to be aware of the warning signs because catching it early is so important.
Imperative, really. We want to welcome Allegheny Health Network medical oncologist, Dr. Dulabh Monga, and one of your patients, 6-year pancreatic cancer survivor, Kathy Shaffer. Thank you both for being here.
Thank you.
And doctor, tell us how common this is. We've said it's uncommon. Certainly now with Alex Trebek, people are talking about this much more.
Absolutely, yes. So this is a disease that accounts for up to 3% of all cancers. And it's responsible for about 7% of all cancer deaths. So it is relatively uncommon, but I think that because more and more patients are getting aware about this disease, they get more scans, and we are picking up this cancer at an earlier stage.
Well, and part of the problem is that once you notice some of the symptoms, which can seem like anything really, it can be too late. It can have metastasized.
That's correct. So the thing is that where the pancreas is located, sometimes even if the tumor is really small, it can cause a lot of problems, and it can obstruct the bile ducts, and it can give patients symptoms such as abdominal pain, back pain. Sometimes patients can develop jaundice, which is yellowing of the skin and the eyes, nausea, vomiting, weight loss, loss of appetite. So those are the common symptoms that we see.
Well, I mean, if you have back pain, your immediate thought isn't, well, I must have pancreatic cancer. Right. You might think I pulled something, lifting something,
Right. So a lot of people ignore those symptoms, thinking that it's, probably musculoskeletal pain, maybe it's indigestion. And so that is why when it's diagnosed, it's pretty advanced. Yeah.
Kathy, tell us about your story. First off, we're so thrilled that it's almost 6 years for you and you're cancer-free.
Yes.
That's fantastic.
In 2014, in January, I started getting just a dull pain, not a hard, strong pain. And I pulled a muscle in my up here 2 years ago, before that. So I figured, I pulled a muscle again because we were putting away Christmas decorations. But going into February, I got that I couldn't eat well, got nauseated, so I decided I need to go to the doctor. So I went, and luckily my PCP,
knew the symptoms, knew what to do, and recommended.
She gave me the right tests. She did enzyme tests for my pancreas, and a sonogram, and then eventually the CAT scan, which showed the mass on there.
Well, and I think that's true about like having a good doctor and recognize those symptoms and not just disregarding them as something else. So you're very fortunate.
Yes, I was very fortunate, yes.
And doctor, there are new treatments too. Like there's technology that's changing how you care for this, right?
Yes. So we've recognized that there are certain genetic mutations that may be associated with pancreas cancer. Some of these are called the BRCA1 and 2 mutations. It's also sometimes associated with Lynch syndrome, although not that commonly. Now that we're testing all pancreatic cancers for these genetic mutations, because there are some drugs that can target that mutation. But that's in a small percentage of cases. We have made some strides in the chemotherapy we administer, resulting in longer survivals. A lot of research going on in pancreatic cancer. We're looking at different drugs such as cancer vaccines, looking at monoclonal antibodies. Immunotherapy trials are ongoing. So these are all in the works right now, and we're hoping that in the next couple of years we'll have better treatments.
And you said the BRCA, is this the BRCA gene that we hear about that's associated with breast cancer?
Correct, yes.
Interesting. One other thing that I read was this new therapy called PRRT for short. Explain how this works, because it seemed pretty intense when I was reading about it.
Right. So there's a type of pancreatic cancer that is 3% of all pancreas cancers. So it's a rare type of pancreatic cancer called pancreatic neuroendocrine cancer. The one that Kathy had was pancreatic ductal adenocarcinoma, which is the most common variety. So this new treatment is for pancreatic neuroendocrine tumors. It's also known as peptide receptor radionuclide therapy. So what it is it's a radioactive material that's attached to a protein, and a targeted protein that recognizes these neuroendocrine cells. So the radiation only goes to those cells that have this special protein. and delivers radiation therapy. And we've seen long-term survivors with this type of treatment.
That's fantastic.
Yes.
It's great to hear
Incredible.
promising news, and it's great to see you here telling your story,
Yes,
Kathy.
yes.
Thank you so much.
That's- I first was diagnosed, I didn't know anybody that survived, so
Right. Well, you've heard that for so long, but now we're hearing about new treatments and new therapies.
Yes, yes.
Certainly remarkable.
and I've been very blessed.
Thank you.
Fantastic. Well, we want to thank both of you for being with us today and to help raise awareness of the importance of early detection and also the latest treatments for pancreatic cancer. And look for more information on cancer care at the AHN website. You will find the link at pittsburghtodaylive.com.
And keep watching for our Eye on Health series here on PTL. It happens on Wednesdays, brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.